One of the most important things is that the pain related to gluteal tendinopathy is over the greater trochanter. Okay, so that is important. It's not, somewhere towards the groin or somewhere in the back of the buttock. It is over the greater trochanter. Plus or minus, they might have pain down the lateral thigh. And occasionally it can even extend into the upper lateral leg. And that's probably in people who have some involvement of the iliotibial band that, of course, does cross the knee and join into that lateral leg there. So in some patients, it does cross the knee. Others sometimes say if they have pain that goes below the knee, it's definitely not related to the hip, it's the back. Not necessarily. But of course, if you're starting to get, pain in your foot and paresthesias in your foot, we're obviously not dealing with just gluteal tendinopathy there. So that's the area of pain, which is really important. And tenderness over the greater trochanter is really important as well. So the patient will often report that they have pain lying on their side at night. And to try to differentiate that between hip joint pain and tendon pain. People with gluteal tendinopathy will have tenderness directly over the bone when they lie on that side. And so they go, oh yeah, that bone's really tender when I lie on my side. As opposed to if it's a hip joint related pain, it'll be more a deeper general ache around the hip rather than that direct tenderness over the bone. And they'll also have pain lying on the other side, because even when they're lying on their unaffected side, when the knee is hanging down into adduction, they'll often get pain, on the top side as well. So pain lying on the side is a very common problem for patients with this condition. And then other key symptoms are pain standing on one leg, so standing on one leg to dress, walking upstairs. Pain with stair walking, particularly upstairs, but down as well, is a problem. Walking, and depending on the level of clinical severity, it might just be, walking 10 metres. It might be, only walking, for long walks or fast walks or hill walks, those sorts of things where we have that higher challenge to the adductors. Then we start to get some pain. For younger ones, it might be running. So it might be running or step type classes in the gym, high step ups, things like that. So they are most typical presentations. In terms of who, the biggest population we see presenting with this condition is postmenopausal women. So about 1 in 4 women over the age of 50 will experience gluteal tendinopathy, much lower in men, so less than 1 in 10, so 8.5% or so in that age group over 50. So that's the biggest population, but we do also see it in younger active individuals. And again, I see it more commonly in females. One of the typical presentations I see in younger females is after having babies, and then they'll be getting back into their running or their sport, and it's particularly sort of those running or, as I said, step class or boot camp, things where you're sort of doing dynamic sort of control, require that dynamic control around the pelvis. So often females returning after having a baby may not have completely regain that control around their pelvis, and then perhaps increase their training volume a little bit too quickly, and then they start developing pain around the lateral hip. So they're probably the most common populations that we see.